Hey everyone, and welcome back to the channel. Today, we're re-diving into a topic that many of us might experience. You know that feeling, numbness, tingling, or maybe your feet are always cold, even under a pile of blankets. These aren't just minor annoyances, they could be your body's way of sending you a warning signal. So, let's talk about what's really going on when your legs are trying to tell you something, and more importantly, what you can do about it. In simple terms, it means that blood isn't flowing efficiently through your body, especially to the parts farthest from your heart, like your hands and feet. Our circulatory system is like a superhighway for blood, delivering oxygen and nutrients to every single cell. When there's a traffic jam on this highway, particularly in the vessels leading to your legs, problems start to pop up. So, what are the signs? The most common ones are cold feet and hands. If your feet feel like ice cubes no matter the room temperature, it could be a sign that not enough warm, oxygen-rich blood is reaching them. Another classic symptom is numbness, or a pins and needles sensation. This happens when nerves aren't getting the blood supply they need to function properly. You might also notice swelling in your feet, ankles, and legs, a condition known as edema. This occurs when poor circulation causes fluid to build up in your tissues. Some people experience muscle cramps, especially in the calves, that can be quite painful during a walk or even when you're resting. Your skin might give you clues too. You could see changes in skin color, with your legs looking pale or even bluish. The skin might also become dry, and hair growth on your legs could slow down or stop altogether. In more serious cases, you might notice that sores or cuts on your feet and legs are very slow to heal. This is a big red flag because it means the area is uncutting the blood flow needed for repair, increasing the risk of infection. Now, you might be wondering, what causes these circulation traffic jams? There are several culprits, and one of the biggest is something called peripheral artery disease, or PAD. This happens when the arteries that supply blood to your limbs become narrowed or blocked by a buildup of fatty plaque, a process called atherosclerosis. It's like a clog in your body's plumbing. But it's not just about arteries. Sometimes the problem lies in our veins. They form when the tiny valves inside our veins weaken, allowing blood to pool instead of flowing back to the heart. Blood clots are another serious cause. A clot can form in a deep vein, usually in the leg, a condition called deep vein thrombosis or DVT. This is a medical emergency because a piece of the clot can break off and travel to the lungs, which is life-threatening. Certain lifestyle factors and health conditions can dramatically increase your risk. Smoking is a major one. It damages the lining of your arteries and makes your blood thicker and stickier, making it harder to flow. Living a sedentary lifestyle is another big risk factor. If you sit or stand for long periods without moving, blood can pool in your legs, putting pressure on your veins. Your diet also plays a huge role. A diet high in saturated fats, sugar, and salt can contribute to plaque buildup and high blood pressure, both of which hinder good circulation. Conditions like diabetes are also closely linked to poor circulation. Obesity puts extra pressure on your whole body, including your circulatory system, and high blood pressure and high cholesterol are direct contributors to the artery damage that leads to poor flow. Okay, so we've covered the what and the why. Now for the most important part. What can we do to fix it? The good news is, for many people, simple lifestyle changes can make a world of difference. The number one thing you can do is get moving. Exercise is like a wonder drug for your circulation. Activities like walking, swimming, cycling, and even yoga are fantastic. Walking is especially great. Just 30 minutes a day can significantly improve blood flow. When you walk, your calf muscles contract and squeeze the veins in your legs, helping to push blood back up toward your heart. It's like having a second heart in your legs. If you have a desk job, make it a point to stand up, stretch, and walk around every hour. Even simple exercises at your desk can help. Try rotating your ankles, pointing and flexing your feet, or doing some calf raises. These small movements keep the blood from pooling. When you're relaxing at home watching TV, try to elevate your legs. Propping your feet up on a pillow so they reach above the level of your heart uses gravity to your advantage, helping blood flow back to your chest. Let's talk about what's on your plate. A heart-healthy diet is a circulation-healthy diet. Focus on eating plenty of fruits, vegetables, whole grains, and lean proteins. Also, be sure to stay hydrated. Drinking enough water helps keep your blood at the right consistency, making it easier for your heart to pump, and try to cut back on processed foods, excessive salt, and unhealthy fats. For those who smoke, quitting is one of the most impactful steps you can take. I know it's incredibly difficult, but the benefits to your circulation and overall health are almost immediate. There are many resources available to help you quit, so please consider reaching out for support. Compression socks or stockings can also be a game changer for many people. These garments apply gentle pressure to your legs, which helps prevent fluid from building up and encourages blood to flow upward. They come in different levels of compression, so it's a good idea to talk to a healthcare professional to find out what's right for you. They're especially helpful if you're on a long flight or have a job that requires you to be on your feet all day. Warmth can also provide temporary relief and improve circulation. Taking a warm bath can help relax your arteries and veins, allowing blood to flow more freely. Just be careful if you have nerve damage from a condition like diabetes, as you might not be able to accurately judge the water temperature, so always test it with your elbow first. Now, it's crucial to know when to see a doctor. If you experience sudden, severe leg pain, swelling in just one leg, or a leg that is pale, cold, and has a weak or absent pulse, you need to seek immediate medical attention. These could be signs of a blood clot or a severe blockage. If your symptoms are more gradual but are affecting your quality of life, make an appointment with your doctor. They can perform a physical exam and may order tests like an ankle brachial index test, which compares the blood pressure in your ankle to the pressure in your arm to check for pad. An ultrasound can also be used to visualize blood flow and check for clots. Depending on the cause and severity of your poor circulation, your doctor might recommend medication. This could include blood thinners to prevent clots, medications to lower blood pressure or cholesterol, or drugs that help widen your blood vessels. In more advanced cases of PAD, procedures like angioplasty or even bypass surgery might be necessary to restore blood flow. But let's bring it back to what we can control every day. It's about building small, consistent habits. Start with a short walk. These choices add up. Think of it as investing in your future health. Listening to your body is key. Those little whispers, the cold toes, the tingling sensation are messages. Don't ignore them. By paying attention and taking proactive steps, you can improve your circulation, boost your energy levels, and reduce your risk of more serious complications down the road. It's about empowering yourself with knowledge and taking action. To recap the key takeaways: move your body regularly, eat a balanced diet, stay hydrated, manage your weight, and if you smoke, please seek help to quit. Elevate your legs when you can, and consider compression stockings if you sit or stand for long periods. Most importantly, don't hesitate to talk to a healthcare professional if you're concerned. Your health is your greatest asset. Thanks so much for tuning in today. I hope this information was helpful and empowers you to take better care of your circulatory health. If you found this video valuable, please give it a thumbs up, and don't forget to subscribe for more content on living a healthier, happier life. Drop a comment below if you have any questions or want to share your own experiences.